the beginning of a revolution in healthcare. NorWest Co-op Community Health focuses on engaging our community in cooperative health and wellness. Our team is committed to working with individuals who access our community-based services and programs in primary healthcare, community development, counseling, support services, and early learning and childcare. As the only health cooperative in Manitoba, NorWest Co-op Community Health was established at a time in history when community leaders began to question traditional healthcare delivery. NorWest founders understood from the very beginning that health and wellness would be grounded in community engagement and empowerment. It was the incredible determination of the founders of the Cooperative Housing Association of Manitoba that eventually led to the creation of NorWest. This cooperative housing association established Canada's first permanent nonprofit housing cooperative, Willow Park, whose residents became some of NorWest's first neighbors. In 1972, the Cooperative Housing Association of Manitoba commissioned a study about health services in North Winnipeg.
So they came together to actually do a feasibility study called Health Through Cooperation, and that allowed for the beginnings of that vision and then actually the birth of NorWest, where the care of the individuals encompasses a whole team of providers as well as the client, the family, the community.
The mandate given to NorWest through the study presented a completely new approach to healthcare. At NorWest, preventative care will be a fact, not a concept. The physician will become a member of a healthcare team, not the leader. The patient will become an individual, not an illness, and health will involve the dentist, the nurse, the nutritionist, the social worker, the pharmacist, the community worker, and the community working together, not in isolation from each other. Placing community need and capacity at the forefront, NorWest became a beacon of innovation, compassion, and community-driven care with 8 sites serving Northwest Winnipeg and beyond.
First day at NorWest over 30 years ago, when I was greeted by Susan Benoit, the receptionist then, and one of the nicest people I've ever met or worked with. I was eager to start my nursing position in the community as a primary care nurse and use my knowledge in supporting the families. Little did I know then that I would actually stay working with NorWest for almost 30 years. Initially as a primary care nurse, and then that evolved into being the leader of the primary care team, which is the medical team, before I retired.
The neighborhood surrounding NorWest in 1972 held within it the pain and trauma caused by colonization and settlers to this land. In December 1963, 9 years before NorWest began, in order to make room for a new development on Jarvis Avenue, the City of Winnipeg moved 126 Indigenous and Métis families to what was then the borough's Keewatin housing development, later named Gilbert Park by the local tenants association. The Indigenous and Métis families continued to face racism, discrimination, and poverty in this neighborhood, where resources and access to food were scarce. Within a few years, a small co-op grocery store opened at the new Willow Park Housing Cooperative. Longtime residents of Gilbert Park and the surrounding area remember this grocery store as the only source of food in the neighborhood. With the recognition that North Winnipeg desperately needed health services, the Cooperative Housing Association of Manitoba hosted an inaugural meeting in October 1972, and NorWest was incorporated as a non-share cooperative on November 27th of that same year.
The reason they needed a co-op is because it was, if you go back to 72, this area wasn't serviced and to the extent it was needed. The geographic or the cultural geographic of this area wasn't serviced by Winnipeg, okay, and that was a problem. So that started the health co-op. At that time, they had a physician, a nurse, and a few other staff.
Rooted in resilience and planted firmly in the cooperative values of self-help, self-responsibility, democracy, equality, equity, and solidarity. NorWest continued to listen, learn, and leverage resources. True to its mandate, NorWest began not only with medical staff, but also with a home economist, family life counselor, community health counselor, and a partnership with legal aid.
I still remember the stories and then the actual grassroots work facilitated by the initial health educator and the health promoter. And those programs still exist today. Those initial programs and the initial little tiny medical team actually were the building blocks of what NorWest is today. And those programs included things like community food bingo, lifestyle lottery, which was a cardiovascular health program, parenting groups, congregate meals and income tax services for the immediate community, as well as numerous community cleanups, barbecues, powwows. So many of the programs that we have today, many of the actual services are all related to the original work, as well as all the needs assessment and strategic planning.
The 1980s saw the expansion of health programs and partnerships. The formation of the Manitoba Association of Community Health Centres proved essential in coordinated health and social services in Winnipeg.
One of the philosophies that NorWest had that I learned very quickly, and it's not written anywhere, I don't think, but it's sort of this underlying culture of NorWest, is if there's a need, we will try to fill it. And then trying to meet those needs was really difficult when we had limited staff and limited space. There are a few things that NorWest did to try and deal with a lot of those challenges that we faced. One was connecting with some of those outside organizations.
NorWest was actually the first community health center to embrace quality and accreditation. So prior to all the health region and other centers becoming accredited, NorWest board and leadership with staff participated in accreditation. And that meant that clients accessing our services could be confident that we had actually high quality of services that met standards, that they were able to actually timely access those services.
In the early 1990s, NorWest helped to create neighborhood networks, school outreach committees, and was already doing joint programming with the then City of Winnipeg public health nurses. Towards the end of the 1990s, partnerships and pilot projects paved the way for improved health, equity, and inclusion. Visionary partners like the Winnipeg Foundation and United Way funded NorWest demonstration projects that became standard practice, including family violence prevention and Indigenous health outreach programs. Over time, our Indigenous health program evolved to provide access to many traditional practices. However, adequate funding for present-day cultural programs for Indigenous peoples continues to be a challenge.
The Indigenous programming that we run here helps the community be able to kind of grasp a part of their culture back again by learning them some of those traditional things, such as making ribbon skirts, making moccasins, making drums, making shakers, having drum clubs. I think it's helping heal people in a way, because culture is kind of a big piece that's missing in the Indigenous community.
As NorWest's services continued to grow, so did the team. By spring of the year 2000, there were 31 staff, and NorWest had to move their Sunshine Day Nursery to a new site further west, where it became the NorWest Early Learning and Childcare Center. As the Inkster area continued to grow, it became more culturally diverse as the Filipino and soon the South Asian communities brought life and vibrancy to the community. NorWest recognized the unique challenges and opportunities faced by newcomers and sought to create a more inclusive and supportive environment, so NorWest welcomed the citywide Immigrant Women's Counseling Services. Community outreach, service networks, and the support of the United Way led to the development of 3 neighborhood resource centers. The first in 2003 was NorWest on Alexander, followed a few years later by Gilbert Park and then Blake Gardens. Neighborhood advisory committees brought forward ideas and helped build strong relationships and leadership skills.
Our leadership team here really involves everyone's voices. So it's not a traditional leadership team, and that has enabled us to grow. It's enabled us to seek out partners where people thought it would never work before. It's enabled us to go into community and build relationships where people never thought possible. It's enabled us to have trust with community, with our partners and with our funders. And as we go forward into the next stage, I really hope that's something we never lose, because I really truly believe it's what defines NorWest, is that every single voice is important.
Based on NorWest's research on the work and healthcare cooperatives across Canada and internationally, NorWest developed and delivered Hands Kai, a community-led healthy living program based on a similar initiative of health co-ops in Japan. The words Hands Kai mean group meeting in Japanese. NorWest now trains other health cooperatives to facilitate this program.
I think one of our strengths is our staff. They work so closely with our community. They know where the gaps are, and they begin to work with us to fill them. I think that encourages people to keep taking more and more risks and to really try to reach out. And so we have staff across our organization that are constantly saying, hey, can I apply for this because I think we really have a need here. And so people have just become risk takers as well and really trying to meet the need.
For many years, the limited bus routes and geographical divisions due to the railway tracks meant that it was very difficult for Weston and Brooklyn residents to attend the Tyndall Ave site. In 2012, after several years of advocacy, NorWest received funding and opened the NorWest at Bluebird site on the corner of Keewatin and Alexander. Building on existing partnerships with the Winnipeg Regional Health Authority and Family Services, NorWest opened a new access center in 2014 and celebrated our community by showcasing their creations with an art exhibit show and sale. Shortly after moving into this new building, NorWest supported Gilbert Park to host a powwow and work with community members who worked with children and youth, make their own regalia and taught traditional dance. For many, it was their first time reconnecting with traditional cultural practices. After years of service, the small co-op grocery store that once fed families in Willow Park and surrounding communities shut down. Inkster became a food desert, and food security became a major concern in our family resource centers.
And then we saw the opportunity for a community food center, and we jumped on it. So we reached out and we applied with Community Food Centers Canada. And we were successful, and we created the first community food center in Western Canada. And it was so exciting. We now had a model that could create healthy food, build capacity within our community around food.
Over the years, NorWest witnessed an increasing crisis in youth mental health.
Youth were just struggling in our community with their mental health, and we would sit around tables trying to figure out how we could serve them better. And truthfully, not that successfully. And then we saw a model out of Australia. And we brought our experts together, we brought our youth together, and we brainstormed. We took that model and we modified it. And we started our NorWest Youth Hub in 2017. And we were able to help thousands of youth with their mental health. We're still going today. That model has just recently been replicated across Manitoba, so we're very proud of that.
In January 2023, as we began our 51st year, the Huddle NorWest Youth Hub opened in a new integrated services site on Notre Dame Avenue.
That's sort of where I always say community development happens. It happens on the street. So I have had such deep conversations with people just on the sidewalk and really get to know what they're looking for and what they're needing. And part of the work we do is advocacy. And so I think by having your ear to the street and relationships and that trust, you're able to kind of provide the services that are maybe missing in people's lives.
Today, NorWest hosts over 45 programs, which include parent and child programming, creative arts, wellness and fitness, as well as fresh food markets, and operates an urban farm.
We used to see some of the children or the teens, over 30 years ago, and many of the individuals and families still live in the community, and we see them, go to school or volunteer at many of our advisory committees, or become one of the volunteers at the Community Food Center. Many of them actually are working now at NorWest or leading new projects. And it's like the whole cycle continues, and their children are now volunteering, or their children are in a daycare. It is like a cycle of life, right? It's really wonderful to see.
If I could say anything about NorWest, I would just say that working here and like it's such an amazing experience, and I've had such an amazing experience. Like I said, I didn't plan on staying here, and now I don't. It's hard to picture me leaving. And then like my family kind of grew up around like it's NorWest no matter what, and just the culture that's here is one that I've never seen in any other workplace. Like where everybody's equal.
It is the personal and collective stories of our community who succeed in spite of incredible social and economic barriers that have inspired NorWest every step of the way. Mirna, an active participant with Hans Kai, and teaches Zumba to program participants. Mirna's commitment to this community led to employment with NorWest. She is now a part of our community development team.
How does Hans Kai build community? Participants of Hans Kai program comes from different ethnic backgrounds, which develops friendships and relationship among the participants. How did Hans Kai impact me? I became more conscious and aware of my health. I learned the importance of eating healthy and be physically fit. As an instructor, I became more acquainted with all my participants, and I became so much aware for their health and physical fitness needs.
Cassandra lived in Gilbert Park with her children for many years. Cassandra worked hard to support her family in the neighborhood. In telling her story, Cassandra sometimes shares that she now donates to the very programs that were once a lifeline for her.
I have accessed services through this organization for at least 22 years. So the first thing I can remember about accessing NorWest is a mom support group that I went to when I had 4 kids. I had 5 total. We had a lot of things going on, so I had to get better and heal. My kids needed to heal, all kinds of things. There's a lot of service providers, like lots of agencies, service providers, counseling, CFS, EIA, like all kinds of things.
John first met NorWest staff on Alexander when he came into the resource center during the day and played on computers instead of attending school. John's relatives were survivors of residential schools. With time, John came to trust NorWest staff and was soon attending school, participating fully in resource center activities and serving as a mentor for younger children.
I started skipping school. I was staying at home all the time. And so the one constant that was a positive was NorWest. Caprice, she was a huge, huge factor in my life. She was like, kind of looked up to her as like kind of like a mentor outside of the home. She was just always really positive with me. But I think that's part of where the power with NorWest is like, not just the fact that it brings the communities together, but the people that they hire are always really good people. Whether they're volunteers or they're people that they're actually hiring, those people also make a huge impact in the people when you come in and you get that warm greeting, you get a hi, how are you? Is that went from bad grades to now I'm working in a law firm as a legal assistant.
As someone who has served NorWest Co-op for the past 15 years and now in the role of executive director, I carry the profound responsibility of leading this organization with the 6 cooperative values as my compass.
Solidarity,
self-help, self-responsibility, democracy,
equity,
equality.
These values are more than just principles. They are the foundation of every action we take. Our work is about more than healthcare. It's about justice. It's about dismantling systemic barriers and entrenched oppression that deny people the chance to live healthy and dignified lives. Every vaccination we administer, every therapy group we run, every community event that we host, these are more than services. They are acts of community building, of equity, of love in action. The NorWest mission demands more than dedication. It demands passion. Only together, with a shared commitment to equity and solidarity, can we bring the NorWest vision to life. And now, for the next 50 years.
How do you want to be involved?